colleagues, please allow me to introduce myself. My name is Adinda Bunga Ramadhania Arsanti, and I am a student of Universitas Diponegoro, majoring Management and Logistic Administration. Before I start the presentation, I'm not alone here. I will be accompanied by my teams from Group 10 Class English Conversation, whom they are. The first one is Samudra, Hulam, Kamarulloh. The second one is Serina, Putri, Handayani. The third is Nurjanah. The fourth is Hafizh, Reza, Saputra. And the last one is Tengku, Shabah, Raihan, Hakim. And I myself, as today moderator presentation, Adinda Bunga Ramadhania Arsanti. Before we start the presentation, we would like to say thank you for being here. And it's our pleasure to giving you this very much important information that we will be sharing today. So without any further ado, let's start our presentation. Have you ever wondered how the logistic distribution in Indonesia works? We all know that in this happening situation of pandemic COVID-19, we have been made struggle a lot, but we finally find the light in the end of the tunnel here. The whole world itself has been starting their vaccination program for their country citizen. So today we will our presentation we will be answering this question for you, and we have divided our talks into 5 points. The first point will be delivered by Serina. The second point will be delivered by Nurjanah. The third point will be delivered by Samudra. The fourth point will be delivered by Hafizh, Reza, Saputra, and the last point will be delivered by Tengku, Shabah, Raihan, Hakim. For Serina, the first presenter, the time and screen is yours.
Okay, thanks to Adinda. Next, here I will explain about our first submaterial, what is vaccination. Vaccination is the administration of vaccine or antigens, which can stimulate the formation of immunity or antibody to the immune system in the body. Vaccination as a primary prevention effort that is very reliable to prevent diseases that can be prevented by vaccination. With the correct vaccination procedure, it is hoped that optimal immunity will be obtained, safe injection, and minimal post-immunization follow-up events. COVID-19 vaccination is carried out after there is assurance of safety and efficacy. It's an effort to reduce morbidity and mortality and encourage the formation of herd immunity. In addition, COVID-19 vaccination aims to protect and strengthen the health system as a whole, as well as maintain productivity and reduce the social and economic impact of society. The next point will be delivered by Camps.
Thank you, Serina. I'm Nurjanah, and I will be presenting about what are the types of vaccine. Types of vaccines in Indonesia are Pfizer, Moderna, and AstraZeneca. Moderna and Pfizer use mRNA, which can encourage the body cells to produce antigens to fight COVID-19. Meanwhile, the AstraZeneca vaccines use a weakened adenovirus to create immunity against COVID-19. Pfizer and Moderna are 95% effective more than AstraZeneca. So far, only AstraZeneca is ready to be distributed in several countries, including Indonesia. AstraZeneca is suitable to choose in Indonesia because it's relative low price. The next topics will be delivered by Samudra.
Okay, next, the importance of vaccination. Number 1, reduce the possibility of severe symptoms and complications due to COVID-19. Number 2, restore the social and economic condition of countries affected by the pandemic. Number 3, reduce the morbidity and mortality rates due to this virus. The next point will be delivered by Hafizh.
Okay, thanks Samudra. Next, I will explain about the benefits of the COVID-19 vaccine for body health. So, here are some of the benefits of vaccine. Point 1, lowering the rates of pain and death due to COVID-19. As mentioned earlier, the COVID-19 vaccine can trigger the body's immune system to fight the coronavirus. This way, your risk of getting infected with this virus will be much smaller. Even if someone who has been vaccinated contracts for COVID-19, the vaccine can prevent severe symptoms and complications. That's why the number of people who are sick or die from COVID-19 will decrease. Point 2, encourage the information of herd immunity. Someone getting the COVID-19 vaccine can also protect those around them, especially highly and risk groups, such as the elderly over 70. This is because the chances of people who have been vaccinated to transmit coronavirus are very small. When given en masse, the COVID-19 vaccine is also able to encourage the formation of herd immunity in the community. This means that people who cannot get the vaccine, such as newborns, the elderly, or people with certain immune system abnormalities, can get protection for those around them. Nevertheless, in order to achieve herd immunity in a society, the study states that at least 70% of the population in the country must have been vaccinated. Point 3, minimizing economic and social impact. The benefits of the COVID-19 vaccine are not only for the health sector, but also the economic and social sector. If most people already have a good immune system to fight COVID-19, this is people's social and economic activities can return to normal. Okay, the next point will be delivered by Tengku.
How does logistics distribution of vaccine works? Step 1. Healthcare. The targets for the first stage of COVID-19 vaccination are health worker assistants, support staff, and students who are currently undergoing medical professional education who work at health service facility. Stage 2. Public service. The targets for COVID-19 vaccination at this stage are public service officer, then workers in the banking sector, state electricity company, and regional drinking water company, as well as other officers who are directly involved in providing service to the community. Stage 3. High risk. The targets of the COVID-19 phase 3 vaccination are vulnerable communities from geospatial, social, and economic aspects. Community. Stage 4. The target of vaccination for the community and other economic actors using a cluster approach in accordance with the vaccine. Logistic distribution. The central government appoints certain business entities as or appoints according to statutory provisions, distribute vaccine, sporting equipment, and other logistic to the provincial health office. The provincial health office distributes vaccines and supporting equipment to district or city health office. Then, district or city health office distribute to public health center and other health service. Vaccine distribution must maintain the quality of the vaccines. The vaccine transfer using a boxcar or public health car using a cold box storage device, vaccine refrigerator, and vaccine carrier. The distribution process of vaccine in Indonesia can be carried out from Aceh to Papua and is already using a good cold chain system to all corners of the country. In addition, special refrigerated storage cabinets in the province can also be used to store vaccines for a period 3 to 6 months with temperature between 2 and 8 degrees Celsius. This delivery can be then be made gradually to the district or city level, to the hospital and public health center. When leaving the cold room, the vaccines must be quickly put into a temporary box special distance to keep the temperature on the way. Vaccine storage. Cold box storage device. Cold box or cooler is an insulated container that can be lined with an ice pack to keep the vaccine within a required temperature range during short-term transport storage. Vaccine refrigerator. One of the special tools for storing vaccines in the vaccine refrigerator. This refrigerated storage device is a different from household refrigerator. The WHO solar vaccines refrigerator is equipped with a thermostat, while regular refrigerator don't have good temperature control and can keep the vaccine cool during a power outage of more than an hour or two. Meanwhile, the vaccine refrigerator can keep the temperature between 2 degrees Celsius and X degrees Celsius, as long as a power cut is not excessive. Vaccine carrier. Vaccine carrier or vaccine container is smaller than a cooler and easier to carry. Temperature resistance between 18 and 50 hours at a temperature of 46 degrees Celsius. Cool temperature and homes with a cold water bag. Thank you.
Thank you for all the 5 presenters who have been presenting our topic discussion today. And we would like to finish our presentation by saying let's get vaccinated. By contributing to vaccination program itself in Indonesia, you could help very much. You could help our country recovering a little faster. So that's all from us. We are sorry for any mistakes and shortcomings. For those, any of you who have a question about this presentation, you could comment down below. That's all from us. Thank you. See you in another time. Wassalamualaikum warahmatullahi wabarakatuh.